Hemorrhoids, piles. Hemorrhoids, also known as piles, are swollen veins that are found inside or around the bottom, the rectum and anus. When the walls of these vessels stretch, they can become irritated. Hemorrhoids are sometimes described as varicose veins of the anus. In many cases, hemorrhoids don't cause symptoms, and some people don't even realize they have them. In other cases, they can be very painful and uncomfortable and cause rectal bleeding. Both men and women are affected. Symptoms. Some of the symptoms may be as pain and discomfort during bowel movements, bleeding during bowel movement, itching near the anal area, hard lumps and swelling around the anus, sitting for long period to pass phases, bloating or abdominal pain. Causes. There are several causes that may cause piles. Straining during bowel movements. This is one of the most common causes. Straining increases pressure on the veins in the lower rectum and anus, leading to swelling and enlargement of the hemorrhoidal veins. Chronic constipation or diarrhea. Both conditions can contribute to the development of hemorrhoids. Constipation often leads to straining during bowel movements, while diarrhea can irritate the rectal area. Sitting for long periods of time. Prolonged sitting, especially on the toilet, can increase pressure on the veins in the anus and rectum, contributing to hemorrhoid formation. Obesity. Being overweight or obese can increase pressure on the pelvic and rectal veins, making hemorrhoids more likely to develop. Pregnancy. Hormonal changes and the increased pressure on the pelvic veins from the growing uterus can lead to hemorrhoids in pregnant women. Aging. As people age, the tissues supporting the veins in the rectum and anus may weaken, making hemorrhoids more likely to develop. Genetics. Some people may inherit a tendency to develop hemorrhoids due to weak vein walls or valves. Heavy lifting. Straining while lifting heavy objects can increase pressure in the abdomen and pelvic area, potentially leading to hemorrhoids. Anal intercourse. This can cause trauma to the anal canal and increase the risk of developing hemorrhoids. Low fiber diet. A diet low in fiber can lead to constipation and hard stools, which may contribute to straining during bowel movements and the development of hemorrhoids. Types. Hemorrhoids can be classified on the basis of type and location, etc. Internal hemorrhoids. These develop inside the rectum. They are usually not visible unless they prolapse, protrude outside the anus, and become enlarged. Internal hemorrhoids may cause bleeding during bowel movements or protrude through the anus as a result of straining. Additionally, hemorrhoids can sometimes be classified based on their severity. Grade 1. These are small swellings inside the lining of the anus and are not usually visible or felt from the outside. Grade 2. These hemorrhoids protrude through the anus during bowel movements but retract back inside on their own afterward. Grade 3. These hemorrhoids protrude through the anus during bowel movements or when strained and need to be pushed back in manually. Grade 4. These are permanently prolapsed and cannot be pushed back inside the anus. They may become thrombosed, containing blood clots, and cause severe pain. External hemorrhoids. These occur under the skin around the anus. They can be felt as lumps or bumps around the anus and may cause pain, itching, or irritation. External hemorrhoids can be more uncomfortable and can form blood clots, thrombosed hemorrhoids, if the blood pools and clots within them. To be continued. Thank you for watching my video. For more videos, kindly like, share and subscribe.